All right. Hey, doctor. Thanks so much for joining me today and discussing what we're going to be doing on our October 7th webinar with you. How are you doing today?
Doing great. It's my pleasure. Thanks for doing this and promoting the event. I'm really excited to be doing this.
So I've got with me, if you are new to this is Dr. Matthew Nejad. He's one of our celebrities in the biomimetic dentistry world. He's been doing this for a long time. And I thought, my name is Matthew. I work with the ABD directly. And I wanted to kind of talk a few minutes with Dr. Nejad about his case studies and what he's going to be presenting coming up on October 7th at our upcoming webinar. So how long you been doing this, doctor? And tell me a little bit about you. And while you do that, I'll bring up our webinar page.
Perfect. I've been practicing total of almost 11 years now, and it's been biomimetic dentistry from the beginning. I had some really amazing mentorship, including Pascal Monnier in dental school. My first practice out of school was practicing biomimetic dentistry. In other words, I started my own office because I wanted to do this type of dentistry, and I didn't see a lot of opportunities to do that if I was working in the corporate world, if I was taking an associate position. So I've been practicing since 2010 doing biomimetic dentistry. I've had mentorship from Pascal throughout the years. I've been teaching with him at USC. And then I also got to work with David Allman and teach courses and really advance my knowledge and experience and my foundation in biomedical dentistry over the past 10 years, almost 11 years.
The Academy of Biomimetic Dentistry is super excited to have you to do one of our webinars. And I mean, thanks so much. And hopefully this is going to lead to a bunch more of leaders in the industry. And, thanks for paving the way. So I'm going to jump onto the ABD website here and just we're going to discuss the topics of what you're going to be reviewing.
Absolutely.
And have you ever done a case study webinar before?
No, actually, that's one of the things I was really excited about because my education's always been on explaining the topic, going through the science, everything. And it's actually refreshing because I'm kind of excited to be lecturing to a group of people that know the topic so that I could really just focus on kind of my thought process on the different techniques that I'm going to be presenting and how I decide from one thing to another without having to explain all the foundation that goes into that.
I know you have a pretty large following on Instagram and people just love seeing all the pictures of the work you do. So that's kind of what we're transferring there into a video format so you can talk and explain while you're doing it. I think that's kind of where the idea came from.
Yeah, my thought on this, do you want to explain how to register for the event and then I'll kind of go through some of those cases? I think that'd be a good way.
Sure, why not? So if you come to the ABD website, academyofbiomedicdentistry.com, you'll have a little button here at the top on the right that says webinar. You can click that, or you can click on Dr. Nejad's name down here, October 7th at 8 p.m. That's a Wednesday, and it's Eastern time. So whether you're on the West Coast or the East Coast or, around the world, in Australia, we'll have some people, I'm sure. You click on this little registration button down here, and it'll take you to the registration page. Get some great information about who Dr. Nejad is if you're not familiar, what he's going to be discussing right here. And then down here at the bottom, this is going to be the most interesting thing that I wanted to show you, is going to be the topics that he's going to be discussing. If this is of interest to you, go ahead and sign up for our webinar right here. And it's a one-step process, and you'll get an email alerting you of the time and date, and that's it. All right, so this is what we're discussing. So please take it away.
Yeah, so my thought here was, because one of the big things that I'm really interested in is explaining the thought process behind when to go from direct to indirect, and then how to even treat like teeth that are oftentimes not even attempted to be restored. So I wanted to go through start to finish, showing kind of in my hands, in my practice with the knowledge and science I have, how I decide between the different case types. So starting from a direct technique, and then when I decide to start going indirect with something a little more straightforward, I'm going to throw in some science about how I make that distinction. Like most of my decisions are based on science and benchmark studies and performance, not just based on preference, but my driving force is always what's the best? Cost aside, what's the best way to do treatment? In an ideal world, if cost was no concern or if everything was free, how would you decide what you're going to do? So we go to the posterior case with an indirect approach. Then I want to talk about complex indirect cases that involve deep caries, complex isolation, difficult to isolate, deep margins that would be typically invading biologic width, and kind of how I restore those. And all the way down to the most structurally compromised tooth, which is these endodontically treated teeth that have no ferrule. They are very often extracted in favor of implant. However, with the right approach, there is chance to give those teeth another life, and a few more years. I've had a lot of cases I've done logic with, and kind of how I restore those. And all the way down to the most structurally compromised tooth, which is these endodontically treated teeth that have no ferrule. They are very often extracted in favor of. I was hearing myself for approach. There is chance to.
Oops, sorry about that.
Did you do something? Yeah, I was literally hearing the playback of what we just covered. So I'll just finish by saying
the pleasures of going live, right?
Right. I was just going to finish by saying that on these other teeth, like I have cases, I have a whole lecture on this topic where I show 7, now 8 cases going on 3, 5, 7, and 7 years is the longest. And my success rate on these is very high. I haven't had any failure yet. Of course, if you have a tooth that's that badly damaged, then it's not expected to perform like, you know, a direct restoration or a straightforward indirect. However, there is a lot of ability for us to provide something of value, and that's what we want to cover in this last case.
You know, I see that we do have a few people live here with us on the call. So I just want to see if anyone's interested and they have a question, feel free to pop it in the chat. We've got a couple more minutes here with Dr. Nejad, and we'd love to take your questions. In the meantime, go ahead.
I was going to say, and so when we do this webinar, we're going to do just about an hour of the case. I'm going to throw in a little bit of science to kind of show you the major reasons why I go this, or this. Like when we talk about margin elevation, I'll mention some of that, but we're going to focus mainly on the case step by step, what I would do without going into like how to do immediate dent and sealing and some of the foundational stuff. And then we'll have 30 minutes at the end to cover questions, review, and so on.
So you're going to take us from the beginning of the journey all the way through to the end in 3 different scenarios. And then
probably 4. We're probably going to try to go with 4 different cases.
Nice. All right.
Yeah.
Well, I look forward to that. Okay, well, I'm going to kind of wrap it up here. And if anyone has any questions, you know, feel free to ask us, tag us in this Facebook chat. Dr. Nejad, I want to say thank you so much for jumping on. It's short notice. I appreciate it.
Yeah, thanks for having me.